Tuesday, 7:45 in the morning, the weekly operations meeting at Cedar Gate Medical Center. On the screen, one slide, a letter from a patient's daughter. Her father sat in the emergency waiting room for 3 hours with chest pain. Nobody called his name. She wrote, "We did not feel safe in your hospital." The room went quiet. Then the chief operating officer, Daniel Rossi, said the number out loud. 94 minutes. Our average wait before a doctor sees you. The national target is 30. And the accreditation team arrives in 120 days. Then he looked at the head of quality, Dr. Maya Chen. Fix this. Properly. This time. Here is what properly means. 94 minutes of average waiting. Nearly 7 patients in every 100 give up and leave before being seen. And 120 days on the clock. Maya's first move was not a solution. It was a team. Priya Nair, who runs the ED nurses, Dr. James Okafor, the physician lead, Thomas Silva, the data analyst, and Hannah Berg, the charge nurse who has watched every quick fix fail for 10 years. And here is where most hospitals go wrong. They jump straight to solutions. More staff, more rooms, a new computer system. Maya did something smaller. She opened LeanProjax, the workspace where this whole project is going to live, and wrote down every problem the emergency department actually has. Then she made the problems compete. Watch how this works. This is the opportunity register. Every idea goes in the same way. A title, the problem, in numbers, a sponsor, and 2 honest scores. How big is the prize? How hard is the fix? First, door to doctor time. 94 minutes against a 30-minute target. Sponsor Daniel Rossi. Impact 5, effort 3, second. Discharges stuck until late afternoon. Beds blocked, new admissions queuing, same sponsor. Impact 4, effort 4, third. Lab results for emergency bloods. Doctors waiting on screens, same sponsor. Impact 3, effort 2. The register scores each idea and labels the winners. Now watch the governance. The winning idea moves through the gate. New, screening, accepted, and then one click. Promote to project. Look what happened. The problem statement traveled word for word into a proper project charter, and around it, the whole structure a project needs. A charter, a plan, voice of the customer, process maps, capability, analysis, risk, recommendations, all empty, all waiting for data. The structure holds the discipline, so the team can hold the pace. From here, the road is fixed, and it has a name. DMAIC. Define the problem properly, measure what is really happening, analyze until the true bottleneck confesses, improve without buying anything new, and control so it never slides back. One phase at a time, one episode at a time, 120 days. Next time, day 1, the charter gets its numbers, the timeline gets its dates, and the team finds out that the first fight is never about the process. It is about the scope. The clock is running at Cedar Gate, 119 days to go. See you in the next one.